Hello, my name is Dr. Craig Childress. I'm a clinical psychologist in Pasadena, California, and I specialize in treating ADHD spectrum issues, angry oppositional kids, family relationship, and marital problems. And today I'm going to talk with you about how to recognize the ADD child. ADD stands for Attention Deficit Disorder, and it's actually a subcomponent of a broader diagnosis having to do with ADHD, Attention Deficit Hyperactivity Disorder. Um, Typically with attention deficit disorder, there is not the hyperactivity involved in that presentation. A child with the attention disorders is going to have difficulty focusing on task and maintaining a focus. They often fly under the radar, and many people believe that girls are more prone to this ADD issue than boys are, who tend to emit the hyperactivity and so get attention for themselves. But a lot of times kids with ADD will just be pleasant and cooperative. They won't present a lot of behavior problems. They just simply won't be doing the work in school. In terms of identifying ADD or ADHD, there's a diagnostic manual called the DSM-4. At this point it's in revision, and there'll be a DSM-5 soon. But essentially for attention deficit disorder, there's a set of 8 symptoms of which the child has to meet 6. And so if the child meets 6 of these criteria, behavioral criteria such as difficulty completing tasks or losing things, then they meet the criteria for having attention deficit disorder. Now, because it's a set of behavioral criteria, there's any number of different reasons why the child might actually have problems with inattention. Probably one of the most frequent ones that I run into are problems in sensory motor processing and sensory motor integration. So that's the first thing I want to look for, is to assess the child's sensory motor functioning. That's for a complete evaluation, that's typically the domain of occupational therapy. So if there's any signs of that, I'm going to ask for a good occupational therapy workup. The other feature, though, is that the inattention can stem from another number of sources. Primary among the differential diagnosis is anxiety. And the anxiety can emerge off of problems in the relationship. And so simply because the child has inattention problems doesn't tell us why the child has inattention problems. And so it's important to get a good clinical workup from somebody who's knowledgeable about ADHD to find out where the issue stems from so that we can appropriately treat the underlying cause of the inattention. For more information about this or other developmental issues, you can visit my website. Thanks very much.